right. Welcome, everybody. We're here for another episode of Lambdas Who Roll Live. I'm here with my co-host, Fernando.
How you doing? Para siempre, Hernan. How's everything?
I'm good, man. I'm good. Another beautiful day. So I'm ready to check out, to talk to Dr. Justin RIOS. I'm super interested in today's topic. We're going to learn a little bit about chiropractic care. But first, before we let him into the talk, I want to just give a shout out to Diego. Unfortunately, he couldn't make it today because he competed yesterday at Grappling Industries along with some other brothers. Want to give a shout out to them. They did phenomenal. They came out with a lot of W's and a lot of lessons learned, and they did really well. So I can't wait to see some of those videos and some pictures. But quick shout out to him. I know he's probably snoozing right now, recovering. So that's the way it is. But shout out to the bros who competed yesterday in Connecticut. So before we get into the talk, Fernando, what's good, man? Everything is good with you?
Yeah, everything's real good. Did some good training this week.
That's what's up.
Hitting some sweeps, things like that. I feel like it's starting to come a little all together for me.
Nice.
Still working on like the cardio aspect of it because due to the pandemic, I'm like severely out of shape. So I'm still trying to work on those kinks, but the game is starting to come together a little bit more.
That's what's up. That's what's up. Yeah, man. I got some mat time yesterday. It was really good. Kind of loosened up the joints today, but we're gonna try to learn a little bit today about chiropractic care. And so without further ado, let's let in our special guest, Dr. Justin RIOS.
Hey, what's going on,
guys? What's good? Siempre.
Thanks for having me, guys.
All right, man. I'm so excited to have you here, man. This is a super interesting topic, and I've been seeing you do a lot of good work on your social media, and definitely going to learn today about what you do. But before we begin, we wanted to get to know you a little bit more.
Sure.
So first, how did you come into the Hermandad, or what interested you? Because you actually pledged at Gamma Lambda, right? The graduate chapter, correct?
Sure. Yes,
sir. So tell us a little bit about that. How did that happen?
So I did undergrad at Valencia College. I transferred over to St. John's University in 2011. I was at St. John's University. I was actually working at a primary care office for about 2.5 years. I was running his office for him. So I was always only going to classes at nighttime. It wasn't until my second to last semester in which I was like, man, I should be enjoying this college experience a little bit more. I'm trying to act all grown, live this whole life, working 9 to 5 and then go to school after. And I didn't want to live without regrets. And that's one of my main things I try to live by, to this day, is just live without regrets. So, I reached out, I used to play a lot of basketball, and I reached out to one of the hermanos who I used to play basketball with. And, I was like, hey, man, so what's going on with this? What do you guys do? And he was like, oh, man, why don't you, come check us out? So I went to an informational, saw that. It was really good. He invited me to another black and white dinner, I believe it was. It was with the, I forgot what organization it was, but it was with an organization in which, I sat down. They treated me like family. I felt like I was already part of the fraternity. I was like, man, this is awesome. A lot of people in which had, a bunch of, the same likes as me. So, I eventually got invited to a few more hangouts, and I let them know, like, hey, I'm interested. What do I do? How do I take it to the next step? And long story short, they weren't able to take me in because of stuff going on with the school. They weren't allowed to take any hermanos in, so we tried to do something in which I signed up for master's classes, and we tried to get me as an undergrad bro there to pledge there, but that didn't happen for whatever reason. So Joel Fernando, my dean, actually, he was always eyeing me. He was always literally going to my interest groups. He was always talking to me after we exchanged numbers. I think the first day we met, and he pretty much reached out to me, and he was like, hey, man, I'm part of GL. And I was like, what's that? And he's like, oh, it's the graduate chapter. I was like, that sounds cool, but I don't want anybody to look down on us. Like, he was like, no, we're good. Don't worry. And I was like, yeah, but I know how, it is with undergrad and graduate, and, sometimes graduate chapters don't get the same respect. So I was like, man, I want to make sure, everything's, the same. Like, no problem. long story short, I continued with my interest and, got invited to a few places, that we can't speak of, but, but everything happened, man. Everything happened for the best. Definitely probably the top two hardest things I've ever done, whether it was physical or mental, but I used a lot of what I learned while pledging and while in the fraternity to get me through chiropractic school, get me through life till this day. I used a lot of those, principles. So it's definitely a blessing. One of the best things I've ever done. Would do it again in a heartbeat. But yeah, that's exactly. So fall 15 graduate chapter, Gamma Lambda, 8 line. I had a 1, Victor Quiros. He went to Baruch College. He works on Wall Street now. So he's a really good bro, and man, one of the best things I ever did for sure.
That's awesome, man. That's great to hear. So now you do jiu-jitsu, right?
Yeah.
You're training. You're actually a purple belt in jiu-jitsu.
Yes, sir.
And so we wanted to we focus primarily on the jiu-jitsu component, but obviously we want to also talk about how jiu-jitsu benefits the community in general, as well as we're going to talk a little bit more about your practice as well. But how did you get into jiu-jitsu? What got you interested in training, and where do you train? How frequently do you train?
Man, so that's a great question. I started training martial arts when I was a kid. My father got me into karate. So I was doing karate as a kid. He boxed in the military, so all I knew growing up was boxing. I had joined a few boxing gyms. I'm from New York, so whenever my parents, say somebody hits you, you hit them back and make sure you hit hard. Right? Yeah. Hit them hard. So I was like, okay, I live by that. And, growing up and boxing, doing karate, and, my father, we would have Mike Tyson fights, with the illegal cable box, and it would last 10 seconds. And I have a bunch of siblings. I have 3 siblings. I have a bunch of cousins, a bunch of family. We'd all get together. And pretty much since it was only 15 minutes, I think my parents didn't get enough. And they were like, go ahead, guys, and your turn. So I would always box with my, brothers, sisters. I'm a kid at this time, 6, 8 years old, probably. Nothing malicious, nothing, too bad or uncontrolled. But I think that's where it started. It's where eventually, as I kept getting older, and now I'm boxing in the gym. Now I'm going to Gold's gym. Now I'm boxing with Golden Gloves, boxers. And I used to fight a lot, unfortunately. Just because moving down to Florida after 9/11, it was a huge culture shock for me. Huge culture shock. I remember seeing on TV, I would see country music and just stuff that I was not used to. And I'd be like, oh, man, that's back in the day. Change the channel. And then, we moved to Florida, and I see people in Abercrombie. I see, very preppy boys. And I'm like, what is this? Like, this is back in the day. I thought this was on TV. Yeah. I'm coming with a jersey, a fitted hat to match, big earrings, and a do-rag on the 3X t-shirt. So it was a huge culture shock. So we immediately clashed. And me, being me, I wasn't taking anything from anybody. So I was getting into a lot of fights. I want to say my freshman year, I got into about 21 fights, had 27 referrals, 0.7 GPA. My whole high school, I only went to one first day of school because I would fight the last or second to last day of school and get suspended, and would roll over to the following, to the next year. So I was a knucklehead. It wasn't until I finally got my butt beat really bad, and it was by a bigger gentleman who was younger than me, but he was bigger than me. He picked me up and slammed me on the ground. I remember my head hitting the ground. A shock, in my head. I'm trying to buck him off of me, and I kept hitting my own head on the ground. And I get home after, lumps in my eyes, black eyes, bloody nose. And my father's like, where is he? Where is he? And I'm like, I don't know. In my mind, I'm thinking, like, I don't want to fight this guy. If he's going to do the same thing he just hits me, I don't want it. Like, after fights, like, finally just getting a handle to me. Literally the next day, I ended up joining the wrestling team. So I joined the wrestling team in high school. I wrestled my junior year. It was a very easy transition to jiu-jitsu. So we started training the month after. So I started training jiu-jitsu when I was 16 years old. I'll be 31 at the end of this month. So I've been training for a while, about 56 years. I did a no-gi. I pretty much did no-gi up to about 5 years ago. So I was all no-gi. When I went to Orlando for my first 2 years, I trained at American Top Team. I did a lot of MMA classes, Muay Thai, Ben Saunders. I knew all those guys, Thiago Alves, all those guys before they even blew up. Before they were a fighter, I used to train with all of those guys when they were purple belts, really, really long time ago. But I was just training for fun. It was always a hobby for me. I always liked it. I always just, enjoyed just doing it. It was a good release for me. It was a good workout for me. Never anything malicious. Never wanted to become a fighter because I knew what it took and I knew I wanted to do more with my brain than my hands or anything. So I trained there a bunch. I ended up moving to New York. I trained Killer Bees there as well. I trained the Henzos for a little bit. I had a buddy from high school who is a black belt at Henzo, so he welcomed me with open arms. Trained there. Eventually got back to Florida. Started training with Fabio Navaez in 2012. So 2012 was when I first got my white belt, but I only trained with him for a few months. I competed in a Naga tournament there. I got like 3rd place, which is pretty good for me because it was like a lot. Like I'm lightweight, I'm like 165 pounds soaking wet. So there's always like 20 plus people in my division. So it was a hard fought tournament, but I ended up in 3rd place. I ended up going back to a college in Orlando and then transferring to New York. So it was a bunch of running around, jumping back and forth. Never really could stick to one professor for him to be like, here, here's this belt, here's this, a lot of people, they want you to be promoted by them throughout time.
Right.
So, for instance, I just got back from Atlanta, from being in Atlanta for 3.5 years, in which I received my purple belt under Kenny Kim there. And my current professor, he will not give me a stripe or anything on my belt. Nor does he claim me as his purple belt, and it's not anything defensive towards me. He's like, you were absolutely purple. You were purple belt before you left to Atlanta. He's just, I don't want to take any credit from your professor who gave you the purple belt. So when I give you the brown belt, it's going to be my brown belt. So I've been training back with Fabio for almost a year now. It'll be a year next month. But I trained with Kenny Kim for 3.5 years. Phenomenal professor, really good. Very acrobatic, athletic. He won Abu Dhabi's, I think 2019 or 2020. Really, really great guy. Picked up a lot from his game, a lot of open guard, jumping pass. Really good guy. And it's pretty cool because, like, even though I wasn't able to stick with one professor since I started back in 2005 or 2006, which was Tampa Gracie. His name was Rob Kahn. He was one of 4 American black belts under Hoist Gracie.
Yeah, I know.
Yep. So I started training. So even though I didn't stick with him and I've been jumping around, because my priority was school and getting my career in order, it was great to see and to learn from different professors. It was almost like having seminars and being able to train with these different guys, because I've learned different things from different professors that, not to say I wouldn't have learned with my current or only one professor, but it was definitely emphasized in a different way. So I was able to, pick up a lot from a bunch of different guys. So it was awesome, but man, it's a lifestyle for me.
That's what's up. So, it's interesting because now a lot of people, they cross train a lot now. People go. There's no longer like I'm only going to train at one gym and that's it. People actually visit other gyms. Even like where in the past it was a one team versus another team. Now they cross train with each other, support each other. But it sounds like your journey was just a natural cross training session. That's good, man. That's awesome. So we wanted to kind of get into a little bit more of your practice, right? Okay. And understand what chiropractic care is about, because for me personally, it's I've been to a chiropractor before as a kid, but as an adult, and I think I mentioned it to you on one of your in a post or something like that. I mean, the cracking is like, it really, I think it freaks people out, right? And I'm sure that you kind of get that a lot, right? So explain to us like what is chiropractic, and so that the general folk can understand what it's all about.
So chiropractic care, man, that was something I never thought I would do, honestly. I was one of those medical professionals who look at chiropractors as quacks. I'm not going to lie. I've said that before. That was probably 5 years ago. My whole life changed. I've been working in the medical field since I was about 15. I was able to shadow my father. My father's a physician assistant, so I was able to shadow my father when I was young. From Salvation Armies to his medical practice to he worked in the surgery center. So I've been able to see a lot of this stuff. In high school, I ended up doing a CNA program. It was a certified nursing assistant. So I worked as that, and then I became an EMT in 2012. So I worked on the bus, worked at many urgent cares, including what I told you earlier. I managed a primary care office for about 2.5 years. So I've been in the medical field for a long time. I've tried different kind of careers in which I didn't like too much, and always found myself back in the health field. So I in 2015, after I pledged, I was working at an urgent care. I was working at 2 urgent cares, actually, one in Brooklyn and well, both in Brooklyn actually, one in Crown Heights and one in Bushwick. Bushwick is where I'm from originally. So I would work a lot, and man, whenever I wanted to take a vacation, I would have to up my hours and work, because we're 12-hour shifts, work 5-6 days straight just to go on that trip I wanted, and I'm like, man, I got to do better, like I can only make so much in so much time, and I can't overdo myself because there's only so many hours within a day. So I started looking into other health fields, health professions. I tried to get in PA school for about 3 years. I was not accepted with a 3.0, with, a good experience. My father being a PA, him being alumni from St. John's as well, like in the PA program, talked to the director. I was doing everything I could just to find out physician assistant is one of the hardest, if not, I think the number one hardest medical profession to get into to this day. Harder to get into than medical doctor, than DO schools, than a bunch of different schools. So I wasn't getting accepted, and I decided to look into other medical fields or careers. I would always have a buddy, Dr. Kevin Kenny. He would always post on Facebook, a bunch of healthy stuff, and I'm like, man, like this is what I, live by. This is what I preach. I've seen probably 20,000 patients in my lifetime, whether it's triaging, whether it's doing any kind of examination, and I'm like, from what I got from that, and the gist is the older geriatric community that was thin, small, and on no medications were the healthiest from my objective perspective, not knowing, what they did throughout their life, not knowing what they did to get there. But I noticed that they were on no medications, they were thin, and they were constantly moving, small. So I was like, interesting, like, why are these, you look like you're 70, but you're 95. You're like, how is that coming about? And it was only probably like 4 patients that I met, but they all had the same thing. And they would always tell me, my blood pressure's high, and no, I don't want medication. I'm like, okay, like, I haven't even checked your blood pressure, but okay, like, no problem, like, you got it. So long story short, I looked into a bunch of holistic, natural ways of treating the body. I would always see patients that would come in, opioids, and I'd have a patient come in like, oh, my throat's scratchy, I just need some antibiotics, I'm going on a trip. And I'm like, I don't know if you need antibiotics for that. Like, you could let your body, fight it off, and then, in a week or two, if you're still not feeling well, then maybe we could talk about it. That's my mind thinking from everything that I've seen. And when I would discharge the patient, sure enough, they would get these antibiotics. And like, they didn't need this. This is the problem. This is why penicillin is not as strong, to this day, and all these antibiotics are not as strong. So after seeing the post from my friend, Dr. Kevin Kenny, I reached out to him. I was like, hey, man, what are you doing? Like, I knew he was interested in physical therapy. I was like, how's physical therapy school? He's like, no, man, I'm in chiropractic school. I was like, really? I was like, man, like, he was like, yeah, you should look into it. Like, we also have a PT program in which you can get board certified for physiotherapy. And I was like, interesting. That's like knocking 2 birds with 1 stone. So I reached out to him. I reached out to the school. I visited the school. I applied for the school. I fell in love. As soon as I got there, I was like, man, this is where I'm going. Like, the campus is beautiful. Like, it's like the people are just so helpful. I literally felt, and I would tell people this, like I was in a fraternity over there. The same way hermanos, like that you never met. They dap you up. They, give you a plate of food, a place to sleep that you've never met. Like, make you feel like family. It was the same way at that school. And I was like, holy moly. Like, I'm from New York. Like, we don't do that. We don't open the door for nobody. Like, my mother would say, like, I don't care if it's Jesus Christ, you don't open the door for nobody. I'm like, dang, mom, like, that's pretty rough. Like, but okay. Like, so, like, for me to be welcomed with open arms the same way they were welcoming me there, I was like, man, this is where I'm going. So I applied, got accepted. 3 months later, I'm moving to Atlanta, somewhere I've never been other than visiting that one time. Knew nobody there. Of course, there was a few bros there, but I knew I was there just for business. I was 27 at the time. A lot of the people who I went to school with, they were 22, fresh out of undergrad. So they had a different mentality. For me, I knew I wasn't getting settled there. It was strictly for business. Once I get done with my business, it's back to work. Wherever that may be, whether it's back in New York or to Florida. So after going to school there, man, it changed my whole life, my whole perspective of the health field. Of course, I still, there's a need to see a medical doctor. If you step on a rusty nail, absolutely go get that tetanus shot, But I think a lot of things, instead of putting a Band-Aid on, we can take care of, by hand. And that's what chiropractic means in Greek, is by hand. So a lot of the issues that are mechanical and not underlying pathologies, I think we can fix by hand. So that's what got me into it. And me being very physical as I already was, me being into jiu-jitsu, it just complemented. And jiu-jitsu has helped my chiropractic career for sure, not only for the patients that I see, but also just being so comfortable with touching the patient or palpating different structures or knowing what the body can take, whether it's a knee on belly, whether it's, putting my hips down. It's like, I know this is hard, and I know an adjustment is not nearly as hard as, what we do in jiu-jitsu on the mat. So it's complimented me in both ways, so that's pretty much how, I got into chiropractic and how much it complements both jiu-jitsu and jiu-jitsu complements chiropractic. But it's awesome, man. It's one of the best things I ever did. I'm super happy. Love what I'm doing. It's I don't even feel like I'm working half the time. So it's great.
That's awesome, man. So can you share a little bit more about like what's behind the science, like so that we could understand what is it, what's about, and kind of like for the person who's just looking from the outside and sees your videos, can understand what's going on at that moment when you're adjusting someone or you're applying pressure at a certain angle.
Yep.
I've seen you put your hands together kind of like in a prayer position, right?
Yep.
Pressing right at the spine, or like twisting the person's hip, and you hear those pops, right? And you mentioned it, I think, in one of your posts, like it's releasing gases, right? So can you go a little bit more into that? Like what's the science behind it, and what does it mean, releasing gases?
Absolutely. So chiropractic done by hand, Greek, Latin, that's how it translates. So pretty much the body, right? The body has joints, muscles attached to bones, and sometimes those muscles get locked. They lock those joints into place. And the gas between the joints, the same way you crack your knuckle, it's pretty much free radical filled. So it can be ions and all types of different, free radicals, in which those are linked to diseases. So by moving the joint in its normal joint play, we're able to release the gas, therefore releasing pressure on the joint, therefore having your normal range of motion restored. So pretty much, so that these hands here, when I was doing that, these are your hypothenar eminences. You have your thenar and then your hypothenar. And pretty much I'm just placing it on the transverse process of the spine. So your spine vertebrae, you have a spinous, you feel those little bones right in the middle, the ones that pop out. Those are your spinous processes. On each side of them, you have a transverse process. Those transverse processes come in contact with the ribs. And there's a lot of joints in between, and every joint has a synovial capsule. Those capsules should not be disturbed with any kind of needle or anything like that, because once you do that, you're looking at all types of adhesion, scar tissue, you're invading pretty much that capsule. So by me, releasing the joint in its normal joint play, it releases that gas without any invasive, properties. So pretty much you're just releasing gas, releasing pressure on the joints. Man, I've seen some crazy stuff. I spend a lot more time with my patients than your normal chiropractor. Usually you're in and out within 5-10 minutes, and I hear it all the time. And me knowing what I know, having a medical background, I'm like, no, I have to do a proper physical. I have to do a proper patient history. Like I spend 30-40 minutes with my patients at least. So I have to do all that good stuff, make sure you are, good to be adjusted, and there's no contraindications such as, oh yeah, I had my neck fused, when I was 36. We're probably not going to adjust your neck, definitely not going to adjust your neck. Now we're looking into fractures, and that's the opposite of what I'm trying to do, is make you pain-free, make you feel better, and it's probably going to make it worse, So doing everything by hand, that's the chiropractic profession in general. A patient comes in, limited range of motion in a way, like for instance, jiu-jitsu, I get tweaks in my neck all the time, man. It's, inverting, going upside down, basing on the head sometimes. And, it's not the best to do, but, it happens. And you get in a bunch of weird positions, and, you end up leaving a little bit more stiff, or locked in joints that, that shouldn't be locked or weren't locked prior to doing it. So by allowing a high velocity, low amplitude adjustment within the joint and its normal joint play, I'm allowed to, pretty much restore that joint, pretty much that range of motion in that joint. So I do a complete physical. It's pretty much, I guess an overview of what I do. I complete physical. I check MRS, which is muscle reflex and sensation. So, the same thing with the reflex hammer, checking, the one on the knees, the hands, the arms. I do muscle reflex, hold here, make sure all the muscles are intact. Then sensation, can you feel this? Does it feel like this on this side? All the stuff that a basic doctor should do in any physical, that's what I do as well. And then I start with, after taking, of course, patient history, I start with percussive therapy. So I loosen up the body with a massage gun, which is great. Helps the patient relax, helps all the muscles become more relaxed, and now they're not locking those joints into place, so that when I do adjust, it goes a lot more smoother. I follow up with adjustments, and then I follow up with advanced therapy or advanced stretching. And stretching is not just your normal stretch, like, oh, here's a straight leg raise. It's a stretch with maybe a dorsiflex at the foot, push against my, my arm, and it's pretty much called PNF, proprioceptive neuromuscular facilitation, and it's like an advanced way of stretching, but it allows the body to open up and the muscles to relax. And since the muscles are, I use the metaphor or simile like an accordion. The muscles open and close, right? Open and close from Z to Z joint, and sometimes muscle spasms or tight muscles, they stay closed. By me stretching the muscle passively, not you doing your own stretch. Oh, I'm actively touching my toes. Yeah, that's great and everything, but I'm going to passively make you touch your toes. I'm going to passively do this straight leg raise, and it's a whole different type of stretch. A lot of athletic trainers do that for all their, their patients and athletes in any kind of sport. They get in this treatment on a daily basis. And for jiu-jitsu, like, if we're not doing a fraction of what they're doing, like, I think LeBron James spends $1.5 million on therapy and rehab every year. Of course, he has the money, but he's getting trained every single day because he trains like an athlete, because he is an athlete. If we're even as hobbyists training as a fraction of the athletes, then we should at least be, doing a little bit of the treatment and therapy and, rehabilitation after. And that's pretty much what I promote, man. My ideal patient is a jiu-jitsu practitioner, but I love kids. I love any kind of athletes. I deal with patients from as low as 6 months to, I think my oldest patient is 87 years old. And of course, it's a lot different for kids being adjusted than for, somebody, an adult or geriatric. For kids, it's usually we're doing very, very light pinky adjustments. 6 months old, very pinky adjustment to the atlas. Let's say a baby can only breastfeed on one side. He likes to turn his head this way. He's not really turning his head that way. As we know, as doctors and chiropractors, we know, 70% of rotation comes from atlas, which is C1, which is the top vertebrae in the spine. That's where a lot of the rotation comes. So if we apply pressure in that way, we can restore pinky pressure, movement for the baby to go this way. And I've had, parents saying like, oh my God, like I've been breastfeeding him 6 months on just this breast. Now after one treatment, he's breastfeeding on the other side. He's turning the other way, and it's both relief for the parent and for the kid. You can only imagine. They can't talk to you. They can't be like, hey, my neck hurts this way. That's why I'm not breastfeeding that way, or, little stuff like that. Checking the hips, making sure it's, equals, symmetric, just very, very basic stuff. And then for adults, obviously, I should go on the videos. And then geriatric, usually by that time, their bones are ossifying. So their spine is literally just one bone. So there's not much, it's irreversible. There's not much we can do as far as adjusting goes. Their neck still moves, obviously, because they're turning right. So therefore, the joints are still moving in that place. And that brings me to my next point. As chiropractors, we preach movement, water, and good foods, right? That's what's going to keep you living long and, and healthy and good quality of life. The moment you stop using something, you lose it. So the moment you stop moving, you lose it. Mm-hmm. If we stop moving our bones, our joints, our spine, eventually throughout time, they're going to connect. Degeneration is going to happen to all of us. That's given. We're all going to degenerate. It's just a matter of like how fast or, how quickly that's going to happen. With me emphasizing or using movement within the joints and the spine, I'm helping slow down that degeneration, which is going to happen. But if I'm moving your joints and your spine once a week, once a month, you're coming to me regularly, whatever plan we have going on, whatever I think, the patient should be seen. By the time they're 60, 50, 70 years old, we're still going to have movement within those joints. As for if you never have movement in those joints, again, you don't use it, you lose it. Those joints are going to ossify, and then we're never going to have movement in those joints. So that's why as chiropractors, we emphasize or we, preach like, hey, like get adjusted, like let me move you intersegmentally. Let me move all your joints for you passively so that we can slow down that degeneration. So by the time you're 60, 70 years old, you're not stiff, you're not stuck in different ways that your body can no longer move, So that's pretty much what I do as a profession. It's good stuff. I love it. Of course, if there's somebody that needs a tetanus shot or somebody that needs, something, go for it. I'll, refer them to my father really quick,
So, and the topic today was really about longevity, right? And for me, I was actually talking to a gentleman yesterday who turns out to be a PT, and that's one question I have for you about that. But we're talking about longevity, and I'm 40 years old at this moment, right? And my goal is obviously to continue training and moving as long as I possibly can, right? So how frequent should someone see you, right? Or should receive chiropractic care? What's the most beneficial? Should it be like a weekly thing, or could it be a monthly thing? What is your advice as far as like the frequency of it?
So that's all really dependent on the patient. It depends what we're going through, what the issues are, if any issues, whether they're a corrective patient or a wellness patient. If they're a wellness patient, that's really no major issues. They're just coming in for a tune-up. I usually tell them once a month, or maybe even once every 6 months. That depends on that patient. As for somebody who has corrective care, like, hey man, I've been getting shooting pains down my leg. Okay, now we're thinking about sciatica. Like, it's not going to take one quick fix. This didn't happen overnight. It's not going to be fixed overnight. So now we got to, chip away at it. So it depends on the patient. If they're coming in with any kind of chief complaints or acute injuries, then we're looking at a few sessions before we can, slow it down. So once a month or once every 6 months. If we're talking about athletes, I'm thinking maybe once a week at least, especially all the, what they're doing to their body. And it depends on their age. So there's a lot of different variables that come into play, but it all depends on the patient and exactly what they're doing. Even for patients nowadays, a lot of things is, from home, everything's on computer, everybody's working from computer. So I'm seeing a lot of upper back, problems just from what is called upper cross syndrome, leaning over, not good posture. I'm seeing a lot of those patients, and those patients I see on a weekly basis as well. They're not athletes, but they're putting their body into positions that it's not, supposed to stay 5, 6, 10 hours at a time, So I give them little hints, such as, hey, for every hour you're sitting, get up, walk for 5 minutes, or sit on the end of the chair. That forces you to sit up straight because you feel like you're falling off, or roll up a towel, put it in the lower back. That'll, emphasize the lumbar curve, so that way you're sitting up straight as well. There's a bunch of different things, but it really depends on the patient, honestly.
Nice. Yeah, man. And so I was talking, as I mentioned, I was talking to the PT. It turned out he to be a PT.
Nice.
Obviously there's a difference, right? And you talked about you doing kind of like joint manipulation, right, to release gases. What's the difference between, for those that don't know, what is the difference between physical therapy and chiropractic care? Is one better than the other, or should they be done both simultaneously? Like, when should you go to which one?
Yeah, so I think they're both complementing. I've heard different PTs from different countries, talk down on chiropractors, and we never talk down on physical therapists because we know they're needed. We all need physical therapy, especially with an injury, especially with rehab and all that good stuff. So it depends on the patient. So for me, I can see a patient right for wellness. I can see a patient who has no major injuries. Of course, I can adjust you. We can get the joints moving. They might not even know, like, hey, I do a full range of motion as well assessment with my patients. Like, oh, turn to the left, turn to the right. Oh, you're not turning too much on the right. Hint. In my mind, I'm thinking, okay, boom. They might not have even known that. They're like, oh yeah, I didn't really notice that. I don't have any pain. I don't have, I didn't feel tight or anything like that. But after we get done with adjustments, now they're looking both ways symmetrically, and they're like, oh man, there's some stuff I didn't even know. Or I had trigger points in my back that I didn't even know if you pressed on it. I wasn't tender here until you pressed on it. So little stuff like that. But usually for PTs, they're seeing patients who are doing rehab, right? Patients who need it, patients who hurt themselves, have some kind of injuries. So they're more on a rehab, accident, trauma-based patient. As for, we can also see trauma-based, but we can also see wellness patients who have no major injuries or issues, just coming in for a wellness check. So PTs are not allowed to do any adjustments. They're not allowed to make any high velocity, low amplitude adjustments to release gas or manipulate the joint. They can, however, move the body into different ways that may release the gas in that way, but they can't document that I adjusted this and I manipulated this. They have to just say I stretched this and gas is released from this stretch. So They do a lot of rehab stuff, in which we do as well. It depends. Chiropractors, it was founded in 1895. The same year X-rays were founded. Makes sense, right? Like, we're dealing with bones, and it just happened to come about like the same year X-rays were founded. So now we're able to see, these issues, whether it's a pelvic misalignment. It's like, man, I was always limping on this side, or stuff like that. Now we're able to see an X-ray, and now we have something backing us up, as far as science and stuff goes. But chiropractic is an art, a philosophy, and a science, right? It's an art because art. It's a philosophy because we got to believe in it. There's a lot of research that goes behind it, and then it's a science as well too, because the same concept. There's a lot of research that goes behind it. But PTs are definitely complementing. I plan on, whenever I open up my office, to have or hire a PT under me as well, just because like I can't spend an hour and a half with a patient if I'm, what I do unique from everybody else is adjustments. If I can just stick to adjustments and have a PT do, the therapeutic exercises or the rehabilitation exercises, that takes a lot of time, that I can spend more with adjusting patients in which they can't, So it's definitely complementing on both sides, just because if I manipulate a joint and the muscles are tight, and again, like I said earlier, the muscles attached to bones, if they pull that bone right back into that malposition or that misalignment, then my adjustment's not going to stand or stay for a long period of time. So by emphasizing or incorporating exercises to allow the body to stay in those normal positions, or that alignment in which I realign the spine or extremity, whatever it is, that helps with the good posture and help with my adjustments pretty much staying in place. So it's definitely complementing on both sides, but I don't see anything bad about PTs or anything like that. I have a lot of PT friends that are awesome, and they talk to me all the time. They reach out to me for help or questions. I reach out to them like, hey, what exercises would you do here, or what so it complements both sides. But it's a slightly different profession. They strictly on physical therapy, and pretty much therapy, the word therapy is pretty much just helping the person rehab whatever accident, trauma issue they got going on. And for me, I can see both therapy or wellness, healthy patient.
So we talked about the spinal alignment. Is there any like correlation? Because myself in particular, I've dealt with like several like injuries throughout my career practicing jiu-jitsu and even in sports. Is there any correlation between having proper spinal health aiding in recovery from like, if you can elaborate more? Yeah.
Absolutely. So just like you see a tree in outside, right? Trees have roots, right? Mm-hmm. If you can use that metaphor or simile, like patients in development in the embryo, the first thing that develops is our nerves. Everything else follows after. So our spine is developed before any of our extremities, before anything is developed. And it's the same way with the tree. Like the roots have to be, grown before the tree can blossom and become, a beautiful tree. The same thing with a person. A person's spine has to, develop, and it has to, become itself before the body can, grow from it. So with that being said, by me adjusting the spine, I'm not only helping alleviate pressure on those spinal nerves, but I'm allowing the body to elaborate or to do what its normal, function is to do. So let's say T4, for instance, T4 nerve, there's a nerve that connects, directly to the lungs and breathing, all that good stuff. And there's nerves that attach to all organs and everything in our body. Not saying that this is going to fix or this is going to be the cure of it, but if a patient's having asthma and I'm like, okay, T4 that, connects close to the lungs, stuff like that, like, let me adjust T4. Of course, they're going to get their asthma treatment from the medical doctor, do everything, but let me, do that kind of things. Or like, oh yeah, man, I'm having shooting pain down my butt, and I'm like, okay, like I end up finding like, oh, okay, it's sciatic nerve. Okay, let's adjust L3, L4, around that area where those spinal nerves come from. Maybe it could be pressured directly from the source, directly from its spine. So by, helping the spine move, we clear the spine before we adjust any of the extremities or anything like that, because we want to make sure that the proper messages are being sent to the extremities, hands, feet, brain, all that good stuff. So that's the best, I guess, metaphor I can use as far as like the spine is the root, the spine is the motherboard of the body. So by even the smallest, because we all know like our fingers are small, the nerves are tiny. You can't even see it on the naked eye. Super, super tiny. And all it takes is a millimeter or a decimeter, the smallest like centimeter, like smallest thing for it to, to push on a nerve for it to cause pain. So by me relieving that pain on those nerves, it allows, the body, the messages to be sent better and all that good stuff. So I've seen some crazy miracle cases in which I never thought either. I was like, I don't know, man, show me the Carfax, or, I need some proof on that, because I don't know. But I've had lower back pain, and I've had my neck adjusted and my lower back pain went away. And I was like, I still, to this day, like, I'm like, I need some, like, where does this come from? How do you, like, oh, well, look up the Lovett brothers and how they're connected. Like C1's connected to L5 and C2's connected to L4. And if you just think of a basic mechanical, whether you're an engineer, whether you're a car auto, repairman, if you just think of the basic, like, if there's a chain and it's pulling and it's really tight because one of those chains are looped the other way, it's perpendicular to all the other, chains. If I adjust or straighten that loop out, that whole chain is going to have so much less pressure on it from each end. So by me, adjusting the spine, I'm relieving a lot of tension, a lot of pressure on all the joints in general, from all the way from C1, or even the occiput, all the way down to the coccyx. Wow. So it's a great, man, it's an awesome profession. Again, if there's a need for a medical doctor, I refer to medical doctors all the time. You need to see an endocrinologist. You need to see OBGYN. There's something that I can't, it's over my protocol. You need to see this person, but there's a lot of issues that to this day that people can have fixed, because I think they're more of a mechanical issue instead of a Band-Aid over taking ibuprofen or, taking opioids or muscle relaxers, that we can help, alleviate, in which I've had miracle cases like that. I've had patients cry, like they've seen me cry. It's like, man, I've been going to this doctor. I've gotten injections here. I've gotten 2 MRIs. I had to go to another doctor for a second opinion, this, that, and third. And one adjustment, they're crying to me like, holy moly. Like, all I wanted was my range. I just wanted to look to my left. Like, all I wanted to, like, I'm like, wow, like 2 years of this, injections, trigger points, physical therapy, medical doctor. They're even talking about surgery at this point. And from one adjustment, like, I'm restoring movement to where they're crying to me, just thankful. And I'm just like, holy moly, like, I'm just doing my job. But man, this is what makes, my job, or what I love about my job, So there's a lot of cases like that I've had. And there's a lot of cases that I'm like, man, like, you have a fracture or you have something in your spine, you have to go see an orthopedic surgeon or go see an orthopedic. So it's very, variable depending on the patient's, issue. But it's a lot of stuff that we can get done ourselves, with movement and just, seeing the proper, adjustments or the proper doctor to, get your problem solved. So it's an awesome thing, man. It's one of the best things I've done in my life.
Yeah, I was going to say, I feel like that's a rewarding part of your field, is to be able to make that difference and see, as you said, like the patient, crying because you made a significant difference in their life and at a particular moment. So, I think that's like really awesome.
Yeah, man, it's awesome. It gives me chills just thinking about it, because that's what I got into it for. I wanted to make people feel better, and by me doing that, now I'm the provider. I'm no longer the guy triaging or taking vitals or administering shots or whatever the case may be. Like, now I'm actually seeing these patients on my own, and I'm able to take care of them. It's awesome, man. It's very rewarding.
Awesome. That's great. And when I was preparing for the talk, I wanted to get to know more about the overall practice and what's involved, and just to read about how, and you mentioned that, the spine, it's basically the center of, of the human body, right? And to hear that through chiropractic care, you can improve digestion, you can, help hormonal balance, range of motion, as you mentioned. I even read, like, this could even help, like, gallbladder issues or like liver functions. And a lot of people don't really realize that just by an adjustment, you can actually alleviate some of the issues that you have that could potentially, that, like you said, most people treat, either taking some type of medication and stuff like that. So for me, that was like the biggest eye opener. I was like, wow, you can improve my digestion simply by just making an adjustment. That's amazing, man.
Absolutely. The messages are being sent better. All the nerves connect to everything in our body. We have to have nerves connecting to our organs. We have to have nerves connecting to our, physical feet, fingers, feet, all that good stuff. So if they're not working, as they should, by me alleviating that pain or that pressure on those joints, the messages are being sent a little bit better. Not to say it's a cure for it,
Right.
There's some stuff, and we can't measure it exactly. Like, oh, your GI system is doing that much better now. But I mean, it just makes sense, and that'd be a hard thing to measure. Maybe that's why, chiropractic doesn't get as much respect as it should, or, credit as it should, but it just makes sense. If I'm adjusting, a certain area, whether it's your spine or your extremities, and you're doing better because of it, I don't know, it's a coincidence. There's, something's going on there. So
that's amazing. Yeah, and this is a lot to take in. Like, so jumping back onto the jiu-jitsu, there's a lot of popular jiu-jitsu practitioners that have opted for chiropractic care. Some names out there: Hickson Gracie, Kenny Florian, BJ Penn, Higa Machado. They've all talked about how they've actually included chiropractic care into their regimen, into their ability to recover. What is the most frequent? Yeah, and we're taking it now from jiu-jitsu angle. Like, what is the most frequent issue that you see from jiu-jitsu practitioners, being the fact that that's one of your areas of expertise is dealing with jiu-jitsu practitioners and martial artists? What do you see as like the most frequent I guess injury or issue that they have?
So the most injury, I would say, or the most common injury would be neck injuries.
Okay.
Neck injury would be probably the most common I see, whether it's a stinger, whether it's a lack of range of motion, whether it's a trauma incident. That's usually what I see most. The second thing I would say is the lack of range of motion. Guys who train jiu-jitsu 20, 30 years, a lot of them can't even extend their elbow completely straight.
Arm bars, right?
These different positions. And I'll try to adjust the elbow, and like it just stays like this. Like there's, probably like a 10-degree bend in their elbows, in which it would never go straight. And that's with the scar tissue, the tight muscles, because usually, jiu-jitsu is a push-pull kind of mechanism. If you're, pulling, you're using your biceps mostly, biceps attached to the lower part of your arm. It's going to keep you in this, position. As for extended, you don't use your triceps too much. I mean, you still use it to push off and all the good stuff, but a lot of these guys get fixated in these different positions. And I believe, of course, we would never know unless we had exact identical twins that were doing the exact same thing at every single thing, moment of their lives. One was getting chiropractic treatment, one wasn't. That's the only way you can truly measure. But I can, from a professional standpoint, I would guarantee that if these, jiu-jitsu guys who were training 20, 30 years were getting chiropractic care on a regular basis, I put my license on it, that they would have normal movement, or at least close to normal movement compared to what they have now. So that's the main issue, is the lack of range of motion, in which we try to restore as much as we can. But again, like I was saying earlier, as soon as you lose it, or you stop using it, you lose it. Bones get fixated, they get ossified, they connect, they start bridging. And if I adjust that, I'm breaking the bone, which I'm not trying to do. I'm trying to, just emphasize good movement and normal movement within the joints. But again, if the joints are already locked up, the bones are connecting, there's not much we can really do. So by jiu-jitsu practitioners seeing, chiropractors and all that good stuff, man, not only are they getting a lot of their range of motion restored, which is what we want. We want to keep moving. We don't want to be stiffened up. They're benefiting their life, their quality of life. They're able to move in ways that they wouldn't have normally moved, because they're actively moving and they're not getting that passive movement, those passive stretches, those adjustments, that gas being released. So neck issues is usually the most common, just because we don't have the rib cage, protecting our neck. So the movement is free moving, especially now with the new age jiu-jitsu, all these berimbolo, squid guard, worm guard, all that stuff. Man, these guys are just tweaking their necks, So that's probably also why you see a lot of jiu-jitsu guys, or wrestlers in general, their necks are so thick. And it's so thick because their body's natural ability to adapt to their situation is to build muscle around the area to guard, to help protect it even more. It's the same concept with life, like eventually it's going to ossify. Eventually, we're all going to be just one bone. You see like x-rays of older, people. It's literally just, it looks like one bone just connected, and you're like, holy moly, it's pretty scary. So it's definitely complimenting for jiu-jitsu practitioners to get chiropractic care on a regular basis, just because we want to keep those joints moving. We want to have your quality of life, so that when you're 40, 50 and you're coral belt or black belt 4th degree that you're able to roll still and move. Of course, injuries are going to happen, freak accidents are going to happen, degeneration is going to happen. But if we can help slow those things down, increase recovery, rehab, everything we can, then not only are they going to live better quality life, but their body's going to move and show of it.
That's what's up. And just quick, we have a message from Joel Fana. He's saying, "Para siempre, hermanos, love to hear it, Dr. Rios." What's up? Shout out to Joel.
That's my guy. That's my dean right there. That's
right?
the plug.
That's what's up. And just a quick shout out to our sponsor, Rolosophy. Be sure to follow them on Instagram and Facebook, Rolosophy, and check out their website, rolosophy.com. Some of the coolest gear, jiu-jitsu gear, and they actually are the ones who make our Hermano rash guards and these. It's coming out soon. So definitely shout out to them. So one thing that I wanted to ask is, obviously, people might not necessarily get a chance to frequently visit a chiropractor. And you mentioned, for example, as a jiu-jitsu practitioner, that the neck range of motion is probably one of the most common injuries that you're dealing with. So what can we do at home to help with our range of motion, that we can't really see a chiropractor frequently, right? What are some of the exercises that we can do to maybe help with that?
So specifically for the neck, they call it red light range of motion. So when you're at a red light, you can do basic circles all the way around, pretty much basic ranges of motion. So you got extension, looking up, holding it for about 5 seconds, flexion, same thing, looking down. You can rotate each way. You can laterally flex each way. You can use your hand to help stretch as well. So you're getting somewhat of a passive stretch both ways, but incorporating good movement. So by looking up the basic ranges of motions of every joint or whatever joint you're trying to work on that specific day and doing those basic range of motions, that's usually with any PT. Let's say you get knee surgery. The first thing we do before we start adding weights or physical therapy activities is we're doing basic range of motion exercises. As for any injury, that's the first thing. Not only are we throwing ice on it, but we're doing basic range of motion exercises. So by doing basic range of motion exercises, you can see okay, I'm limited here, or this side feels better, or I get a little pain there, and you can work on it. You can take mental notes so that in a week or in a few days when you do it again, you're like, oh, I don't have that anymore. Oh, I'm looking a lot more to my left. Interesting, that kind of stuff. But I live by yoga. Yoga is amazing. It's an amazing movement therapy. I mean, the history of it is kind of funny, but yoga, man, it's just good for the body. We can give it to young students. We can give it to older people, anybody, athletes. That's just pretty much just movement. That's pretty much ranges of motion. That's putting your body in movements in which you're not normally putting it in, but it stresses the body into different ways that you normally wouldn't get. So yoga is amazing. I think everybody should do yoga. I always said I would tell people, man, in the U.S. Education system, they should incorporate CPR classes. Everybody should be taking CPR classes. Mm-hmm. Everybody should be doing jiu-jitsu, and everybody should be doing yoga. That's those three things. I'm like, man, because not for jiu-jitsu to go fight somebody or do this to that person or whatever, but it's a humbling experience. Remember, I told you earlier, I got into 21 fights my freshman year. I haven't been in a fight in about 6 years. And after I started training jiu-jitsu, maybe 2 or 3 fights ever. And those are usually free cases and in which they were, some guy touching a little girl on the train. So I had to defend myself, defend her. In another case, the guy, taking advantage of a drunk girl. So it's cases that I just happen to be at that place at that time. It's nothing, but there's been plenty of times people bump into me that when I was younger, hothead, I'd be ready to fight real quick. Or really looking at, that, those kind of things to where now I'm I'm all peace and love, bro. If you really want to fight, I train here. Just meet me here on Sunday, or meet me at this place. But I'm not about that life anymore. I've seen enough World Star videos and YouTube. All it takes is one punch, and I'm not trying to test any of that stuff. So I live by yoga. Yoga is really good for you, man. Really good for the soul. Really good for the body. Just keep moving. Just keep limber. Those basic range of motion stretches and exercises. And that's what I would say. especially for jiu-jitsu, man. Stretching before and after, and icing, ice. There's been a lot of research on ice that it's better than any analgesic, any kind of drug, any pain drug. It's the best you can do for anything, especially within an acute immediate care, which is within 24 to 48 hours. So if you injure something, even if you feel okay, like, oh, I think it's okay, it's just a little stinger, ice it immediately. You'll be like surprised on how well, whether the next day you feel nothing or you forget about an injury that would have lasted a week or so. But ice is one hell of a drug.
That's interesting.
Why is that? Yeah.
Specifically crushed ice directly on the skin, 20 minutes is the magic number. And there's, again, studies with this, PT studies with this. There's graphs, all types of, if you're a math guy, line graphs that show, the benefits of holding it for 20 minutes as for 15 minutes, as for 10 minutes. So those things I would say.
Yeah, we're going to go buy Mad Ice right now.
Yeah.
7-Eleven going to be sold out.
Right.
And it's interesting you say that because if you watch a lot of like UFC Embedded or some of these jiu-jitsu documentaries and stuff, like leading up to a fight, you see a lot of them doing like those deep ice baths now, right? You see that really frequently, right? Yeah, that's awesome. So we actually had a few questions that came in Instagram, and I wanted to make sure that we asked them. The first one was, if I'm rolling 4 times a week, how often should I visit a chiro? And we talked about frequency, but if a person's maybe like very active in the jiu-jitsu, it sounds like 4 times a week is more than the average practitioner. How often do you think that they should see a chiro?
Man, so it's so hard to give. People ask me these questions all the time, and I'm like, man, it's so hard to give you an exact number because every person's case is totally different. Let's say you're training 4 times a week. Is it drilling? Is it hard rolls? Are you rolling with people your belt and size, or did you have a hard competition class? So it's very, very dependent on the person. I would say at least once a month for sure. And then even that, going to the chiropractor, what is the chiropractor doing? Is he seeing you for 5 minutes? Is he taking the quality time to, treat your injuries or to, give you the time you need? Is he stretching you out after? Because all these chiropractors are just doing adjustments and that's it. And then you're off, and next thing you know, you're on getting E-stem or a hot pack, and you're like, okay, I was just in there for 5 minutes. I didn't even get to talk to him because it was just so quick and you're out. So it really depends on what the chiropractor is doing as well too. But even if they're doing the basic minimum, which is adjustments, adjusting neck, thoracic spine, lumbar spine, maybe a little bit of extremities, that's better than nothing, right? So the simple way of training, 1% better every day. Same thing with, chiropractic. If you're getting at least 1% from it, then it's better than nothing, right? So I would say once a month. If you have access and you have the funds to be able to see him once a week, then that's ideal, especially for a jiu-jitsu athlete training 4 times a week.
So I had a quick follow-up to that because I have never been to a chiropractor before, but I am interested, especially after this conversation. So how would one go about, finding a chiropractor that actually will take the time to like get to know you, talk to you about your medical history, spend that quality time with you instead of just, like a 5-minute quick snap, crackle, pop, and then you're on your way. How would one go about that? Or,
So basic Google stuff, right? Google reviews, ZocDoc. I was lucky enough so I started with 83 people in my class, in which I think less than 20 of us finished on time. So I've been able, and we take the same classes throughout, so you get real close with these people. I was able to meet a lot of people that either went back to Ohio, New Jersey, Michigan, different parts of Florida, Texas, California. So I still keep in contact, whether it's through social media or anything like that. But I can definitely refer you some, especially like I'm like, oh yeah, they were a really good student. They adjust really well. They're gonna take good care of you, especially if I refer them to you, or refer them to you, or to them. But definitely looking at reviews.
Okay.
Social media is a huge platform nowadays. That's where I'm getting, I want to say 90% of my, I would say 80% of my clients just from social media alone. Luckily, YouTube is, going off as far as the crack sounds. Everybody's getting addicted to it. You're 2 a.m. just watching, adjustments and stuff like that. 2 hours go by. You're like, oh man, I need this. So I need that one right there. I need that specific one. But definitely doing your research on the chiropractic, because there's a bunch of different chiropractors as well. Just the same way there's a bunch of different medical doctors. You go to a medical doctor that specializes in cardiovascular. You get one in pulmonology. You get one in podiatrist. All different types of doctors, right? they're doctors, but I'm not going to go to a cardiologist if, you know, I'm having stomach problems. I'm going to go to a GI doctor, you know? So it's the same concept with chiropractors. You have to look them up, see exactly what they do. Like, oh, this chiropractor is specifically upper cervical. So that means he's only adjusting your neck. He's not going to adjust your back. He's not going to adjust your low back. He's not going to adjust your extremities. So you have to look into what chiropractor you're going to. Make sure he's full spine if that's what you're looking for. Make sure he does, you know, different soft tissue therapies, but definitely doing your research. So by Google, reviews, ZocDoc, bunch of these different platforms, doing as much research as you can. There's specific chiropractors that only deal with OBGYN and pregnant women. You know, that's amazing. And knowing the benefits of it, I didn't get too in depth with it. I have like 2 pregnant women that I treat now, but if I had 2 colleagues of mine, if they lived right next to me, I would refer them to her for sure. Just because I know she's good at what she does. That's all she deals with. And it's, you know, yeah, I can help, but I want you to get, you know, I want my patients to get the best, you know, treatment they can. So go to this doctor, you know. So definitely looking up the chiropractor, seeing exactly what they do, seeing if they have any videos, seeing if it's something you think you need or want. Because again, there's different chiropractors, a lot of different.
Yeah, especially me, but like I guess extremity wise, because I've had multiple knee surgeries. So, you know, that would be something that definitely would be interesting.
Absolutely.
So Justin, man, we are at the hour. So I wanted to give you about a minute to let us know where we can find you, how we can follow you, how we can get more people to you, man, because you sound like you'd be a blessing for a lot of people, man. And I really appreciate the information, man. For me, it's definitely eye-opening, and I'm really curious. I'm hoping that, you know, you come up to New York or New Jersey, and I meet you there, and we get a session. Man, I'll come to Maryland, man. You know, I'll come and visit. But
I'll definitely come out there.
That's what's up, man. So let us know where we can find you, and you know, shout out whoever you want to shout out. The floor is yours right now.
Okay, awesome. Yeah, you can reach me at prodigyhealthfl.com. That's my booking pretty much website. I also have drjustrios.com. Social media at drjustrios.com or just Rios, and then also same thing, Prodigy Health. DM me, reach out to me if you have any questions. You know, I'll do my best to answer them. That way you can schedule me. I do fly up to New York once a month. I see patients in both New York and Jersey, in which I plan on coming to the next open mat June 4th. So I've been looking at that. Yep.
Yeah.
So I'm looking at that, and then maybe I could treat you guys there as well. So, man, thanks to my athletes. I have 2 jiu-jitsu athletes, Lucas and Jiren or Edward. Phenomenal kids, phenomenal in jiu-jitsu. I think for sure they're going to be top 5, top 10 in the world one day, especially if they continue, you know, the way they're going right now. But man, much love to them. Thank you guys for having me. Again, if you guys want to reach me anywhere, at Dr. Just Rios on Instagram, drjustrios.com or Prodigy Health FL to book an appointment. Thanks, guys.
Thank you so much, Justin, man. It was a pleasure, man, and we hope to see you June 4th, man.
I'll see you there.
All right, brother. Para siempre.
Para siempre. Us.
All right, man. That was Dr. Justin Rios. You know where to find him. Thank you guys for tuning in. You know, I know we went a little over the hour, but man, it was so good, man. Information was amazing.
Very informative.
It's gonna be there June 4th, and that's one thing we wanted to mention. June 4th, our next open mat in New Jersey, Hackensack. You know, you'll see the flyer coming out very shortly, and he's gonna be there. He'll be there. And he said he'll do adjustments, man. I know I'm gonna check him out. And I'm hoping whoever can make it, hermanos who can make it, come and check out Dr. Justin, and let's make it happen. Let's get some rolls in. Fernando, anything to say, my friend?
Yeah, that was very informative. I'm definitely gonna do my Google's research. Hopefully, we can if he goes to the open mat, he'll probably adjust my elbow with the arm bar on my neck with a rim. So I'm looking forward to that. So I'm excited. Shout out to Lambdas Who Roll. Remember to like, share, subscribe. I see we have interesting topics and things like that. So definitely hit that like button and subscribe.
And we'll be back for another Sunday session next week. So make sure you tune in and subscribe to our YouTube channel. With that said, Let's sign off. Para siempre, all right?
Siempre.
Us.